CBT, or cognitive behavior therapy, is a goal-oriented and short-term psychotherapy treatment that includes a practical, hands-on approach to problem solving. It aims to change the behavior or thinking patterns behind the difficulties of people and so alter the way they think. It is used to treat a diversity of issues in an individual's life, from the relationship issues or sleeping difficulties to depression and anxiety or alcohol and drug abuse. CBT works by changing the attitudes of people and their behavior by concentrating on their attitudes, beliefs, images, and thoughts that are held, and how the processes are related to the way an individual behaves as a way of dealing with emotional issues. An essential benefit of CBT is that it is short, including around 5 to 10 minutes for the most emotional problems. So you or the therapist or the patient, none of them have to spend a lot of time. However, different clients attend one session in a week, and every meeting can last even up to 50 minutes if it is complicated. In this time, the therapist and the client work together to have an insight into what the issues are and develop new strategies to tackle them. CBT introduces people to a set of rules that they can apply when they need to, and it will last for their entire life. Cognitive behavior therapy can be considered as a combination of behavior therapy or psychotherapy. Behavior therapy emphasizes on the relationship between our thoughts, our behavior, and our problems. Psychotherapy pays close attention to the importance of personal meaning we give to the things and how patterns of thinking to start in childhood. Many psychotherapists who practice CBT customize the therapy to the personality and particular needs of each client. In the 1960s, a psychiatrist, Aaron Beck, invented cognitive behavioral therapy. At that time, he was doing psychoanalysis. So during the analytical sessions, he noticed that his clients tended to have an internal dialogue in their minds around as if they were talking to themselves. However, they would report only a part of this type of thinking to him. For instance, in the therapy session, the client may be thinking to himself, he means the therapist, he has not talked much today. The therapist has not talked much today. I see if he's annoyed with me. Now, these thoughts may make the client feel annoyed or slightly anxious. The client could respond to this thought with a further idea. Maybe he's tired, or possibly I have not been talking about the essential things. Now, the second thought may alter how the client was feeling. So you see, Beck understood that the association between feelings and thoughts was highly essential. So he coined the term automatic thoughts to explain the thoughts full of emotions that may pop up in mind. Beck realized that people were not aware of such thoughts but learned to recognize and report them. So if an individual was upset in some way, the thoughts were typically negative and neither helpful nor realistic. Beck found that understanding these thoughts was crucial to the understanding of the client and overcoming his or her problems. He called it cognitive therapy due to the importance it emphasizes on thinking. Now it is called CBT, or cognitive behavioral therapy, because the therapy includes behavioral techniques as well. The balance between behavioral and cognitive elements differ among different types of treatment. However, all come under the term cognitive behavioral therapy. CBT is based on a theory or model that it's not the events that disturb us, but actually the meanings we give them. If the thoughts are negative, we cannot see or do the things that do not fit what we believe is right. In other words, we carry on to hold on to the same ancient thoughts and cannot learn anything new. For instance, a depressed man may think, I cannot handle going into work today. I cannot do it. Nothing is right. I will feel horrible. Now, because of having these thoughts and believing them, he may well become sick. If he or she behaves like this, he would not have the chance to see that he has the wrong prediction. He may find the things he could do or some things that were fine. However, instead, he stays at home thinking about his failure to go in and end up thinking, I have let everyone down. They will be mad at me. Why can I not do what everyone else does? I'm so useless and weak. Now, that man may end up feeling worse and has more difficulty going into the work the next day. Thinking, feeling, and behaving like this may initiate a downward spiral. And this vicious cycle can result into different kinds of issues. Negative things do happen to any one of us. However, when we are in a distressed state of mind, we may base our interpretations and predictions on an unfair view of the circumstances, making the trouble that we may face seem much worse. CBT assists people in challenging their negative thoughts. It aids the individual to step outside his or her automatic thoughts and face them out. CBT is based on a theory or model that it's not the events that disturb us, but actually the meanings we give them. If the thoughts are negative, we cannot see or do the things that do not fit what we believe is right. In other words, we carry on to hold on to the same ancient thoughts and cannot learn anything new. For instance, a depressed man may think, I cannot handle going into work today. I cannot do it. Nothing is right. I will feel horrible. Now, because of having these thoughts and believing them, he may well become sick. If he or she behaves like this, he would not have the chance to see that he has the wrong prediction. He may find the things he could do or some things that were fine. However, instead, he stays at home thinking about his failure to go in and end up thinking, I have let everyone down. They will be mad at me. Why can I not do what everyone else does? I'm so useless and weak. Now, that man may end up feeling worse and has more difficulty going into the work the next day. Thinking, feeling, and behaving like this may initiate a downward spiral. And this vicious cycle can result into different kinds of issues. Negative things do happen to any one of us. However, when we are in a distressed state of mind, we may base our interpretations and predictions on an unfair view of the circumstances, making the trouble that we may face seem much worse. CBT assists people in challenging their negative thoughts. It aids the individual to step outside his or her automatic thoughts and face them out. Do you know what is goal setting and why is it essential to set goals in therapy? Well, it is a process of finding out particular therapeutic results for treatment collaboratively. All the goals should be achievable, measurable, observable, and related to the behavioral or cognitive changes appropriate to the client's presenting problem. Goals are linked to particular skills that need to be addressed in the treatment process. Goals increase the session's continuity, allow for focused or directed treatment, and enable the therapist and patient to access the improvement of therapy and recognize changes objectively. Now, when do we set the goal? In addition to recognizing the issue and rapport building, goal setting is among the first therapeutic activities that need to be completed in brief CBT. Though goals can be modified or changed at any point during the therapy, the increase in the benefit requires the patient to set the goal. To increase the benefit and applicability to the patient, an initial set of the goals must be established, and not only established, but also agreed upon by the therapist and the patient both by the completion of the first or second session. So in the first 1 or 2 sessions, all you are going to do is to set the goals together with the patient. But it is also important to set the goals realistically. Now, here are some tips for goal setting that you should use during the sessions. First, provide rationale for goal setting. It assists the patient in understanding the treatment's direction and how he or she will be involved in the process. For example, you can tell the patient, if you can find out what you need to change about your case, we can then take some steps to reduce the issues. So you see, you are tasking the patient to set the goal, to set the objective, to give you the rationale of setting up the goal. So you need to find out what is that the patient wants to change or needs to change. Number 2, elicit desired outcomes. It involves the therapist helping the patient in setting the goals and explaining the reasons for coming to treatment. So as you saw, you already asked the patient to give you the rationale. Now number 2, you can ask the patient, okay, Mr. So-and-so, can you please make a list of a few items you'd get out of this therapy. So let the patient make the list. So here you're already setting up your goal. You're already looking at the desired outcomes. Next, be precise about what the goal is. You see, set each goal, what the goal is trying to target. What is the role of the patient about the goal? Direct the individual towards the goal that include a change for him or her. For example, you can ask, well, you stated what you want your best friend to do. I mean, you said initially that you want your best friend to listen to you. Now, though we cannot make anyone do what we need, what can you do to help you feel heard or cope with the case when you do not feel heard? So you see, you are trying to become precise. Here, your client or your patient complain that, well, I don't feel my friends or my best friends will listen to me. So you need to explain to the patient that, you see, there's nothing you can do. You cannot make someone change his or her mindset. It's you means the patient, who have to find a way, who has to find an alternative that can help you cope up with the case, that can help you feel that you are heard. Okay. Next is state goals positively. It's very important to have positive goals. It explains what a person needs to do rather than emphasizing what he or she does not want to do. For example, you can list, or the patient can list, I want to enjoy my favorite hobbies again. This is a positive goal setting instead of saying, oh, well, I don't want to be depressed anymore. You see? For example, the patient doesn't need to say that I don't want to feel neglected. Okay? Or I don't want to be neglected. Rather, he or she can say, I want to be more involved with my friends. So whatever goal you set it positively. Next, weigh the benefits and costs of a goal. It helps in understanding the benefits and costs of achieving a patient's goal. It can motivate a hesitant patient or recognize salient goals for a passive individual or a person searching to please the therapist. For example, you can ask, if you accomplish this goal, what would be the advantage? What would be some of the costs to you? So let the patient weigh the benefits and the cost of the goal and advise and decide whether he or she wants to go with these goals or not. And the last tip I would give, define behaviors related to the goal. It trains the individual what actions to perform related to the goals that have been set. For example, what would it look like if you were not much depressed? So you see, you are trying to define the behavior. You're asking this question to the patient. What would it look like if you were not much depressed? Or if I saw you and you were smiling, what would I see? What do other people do when they are pleased? What things do you consider have altered in your life since you have been unhappy? Or what did you used to do that you loved that you do not do anymore? So you are trying to define the benefits related to the goals. So if you keep all these tips in your mind, your goal setting, which is one of the most important things to do in the beginning, it will be very easy for you and the goal setting will be very effective. Behavioral activation involves a set of techniques and procedures intended at increasing individual activity and access to reinforcing the circumstances that improve functioning and mood. Activating behavior amounts to the B in CBT interventions. From this behavioral standpoint, as I said, it accounts to the B. So from this behavioral standpoint, depression, for instance, consists of multiple characteristics that play a role in maintaining depressive effect. What are these depressive effects? For example, the feeling of hopelessness, fatigue, passivity, etc. And they don't only play a role in maintaining these depressive effects, but also reduce the chances of adaptive coping through increasing avoidance. Here, the key is that difficulty with mood frequently serves to increase avoidance of adaptive coping. It includes enjoyable events that assist in avoiding and alleviating depression. Reintroduction of the pleasing event is a kind of behavioral activation, and it plays a crucial role to improve mood in multiple ways. For example, it increases the feeling of purpose and usefulness. It increases the self-confidence. It increases physical activity, and also it reverses avoidance. For example, if you used to love to play piano or guitar, and now because you are depressed you don't even do it anymore, it's important for you to do it because you used to enjoy. If you start doing it, you'll start feeling that there is a purpose in life, you are useful, you'll be confident, and you'll start reversing that avoidance. So the B component, the behavior, is very important to change. In 1996, a scientist, a researcher called Jacobson suggested that behavioral interventions improve different mood symptoms but also reduce maladaptive patterns of thought. Behavioral activation includes a host of possible behaviors, including but not limited to reintroducing the prior pleasant activities, like I gave example playing guitar or piano, introducing new enjoyable activities. Maybe you used to play piano and guitar, but now you don't like it anymore. Maybe something new, maybe a flute, or maybe a new sport, anything new which is enjoyable. Then active coping to reduce or alleviate a life stressor. For example, you just take a kind of behavioral action. Now, the examples of behavioral or active coping that are not enjoyable event driven include maybe calling a separated family member. Now you see, this is not an enjoyable activity. It's not playing a piano or guitar, but you're doing something different, which is still a behavioral action. So you're calling a family member who are separated, or you are just cleaning out your wardrobe, or you are just resetting your drawing room, or you had some taxes pending to be filed and you just went and filed. So you're doing something new, which is not enjoyable, but it gives you a purpose of your life. It makes you feel you're still useful, and it avoids it reverses the avoidance. These active coping really help to reduce their stress through overcoming avoidance and accomplishment. It's very important. For example, now let me give an example of a session, okay? There's a patient and there's a therapist. Therapist asks, I want to talk about what your day looked like yesterday. What did you do throughout the day? The patient answers, well, in the morning, I woke up at 9 a.m. and ate breakfast. Until noon, I watched TV, and after that, I ate lunch. Then I took shower around 3 o'clock, and then I went for a walk at 3:30 with my dog. Yeah, that's what was my day yesterday. Therapist says, great. Let me know, how did you feel when you woke up? And patient answers, I feel tired. I did not want to do anything, to be honest, and could not get motivated. I was feeling depressed, I guess. Therapist says, you said that you were feeling depressed. If you had to rate that feeling on the scale of 0 to 100, where 0 is no depression at all and 100 is the worst depression anyone can have ever, then if I asked you to rate it on the scale of 0 to 100, how much your depression was? The patient answered, well, it was 75. Therapist says, okay, what about after you took the shower and went for a walk? How would you rate your depression after that? And patient goes like, well, it was around 30. Therapist says, great. So what do you think? What caused the change in your depression level? Then patient tries to realize, okay, when I got up, it was around 75. After taking walk, shower and all, it became 30. Then patient would answer you that, well, when I got off my bed and started moving, it helped me feel better. And the therapist answers, it would be my guess as well. And you say how you have clearly related, how you have clearly linked the behavior and the mood. So now, since the patient knows that to change the mood, he has to do this behavior. What was the behavior? He took the shower, he went for a walk with the dog and came back. Now he knows that if I do this, my behavior, my mood will change, my depression level will decrease, and this will encourage the patient to use the behavioral activation. Cognitive restructuring is a technique in CBT beneficial for anyone who is struggling with overly negative patterns of thinking and self-talk. It depends on the principle of cognitive mediation, which says that we can alter the way we feel by changing the way we think about what happens to us. Let us talk about how cognitive restructuring works to do multiple things when you are upset or try to break free from negative thinking process or negative thinking patterns. First, it assists you in getting mentally organized. A to-do list helps you feel less overwhelmed and more organized when working on a big project. Similarly, cognitive restructuring supports you in handling better by organizing your mental space in a better way. It forces you to slow down. Now, each negative thought leads to a consistent dose of negative emotion. If you can reduce your thinking and have fewer thoughts, you will end up with the least emotions. It helps you be more aware. The thoughts and the corresponding emotional reactions can occur automatically. Cognitive restructuring helps you notice and become more aware of your mental habit. And it is an essential step in modifying them. It gives you a sense of control and agency. Through noticing your default thinking patterns and then creating new alternative thoughts, you can alter the negative thoughts from anything that happens to you to the things you have great control over. So you see, if you have the sense of control, it relaxes your mind, and of course it handles your thinking patterns in a positive manner. It also helps you think more rationally and clearly. by examining your initial line of thinking and encouraging to questions. The cognitive restructuring helps you see the mistakes and the errors in the way you are thinking. Recognizing cognitive distortions is an essential ingredient in managing your mood and negative thinking patterns better. It assists you in building instead of reacting. So when you are upset, it is reasonable to respond. Distract yourself with any social media platform like Facebook, WhatsApp, crack open another beer, or worry more, etc. If you react without reflecting, you deprive yourself of understanding your mind better and see how it works. Because at the end, what you are doing, you are just distracting yourself without understanding what's happening to you and what are the possible solutions. It also breaks terrible mental habits. We all can get into mental habits, for example, worrying. Just like any physical practice, for example, biting your nail or biting your lips or twirling your hair. The essential thing to break the patterns is to note when we begin doing them and replacing with a different act. Cognitive restructuring forces us to observe some bad mental habits and substitute with the better one. And of course, this cognitive restructuring helps us to build all these mental skills. Well, since now you have an idea about cognitive restructuring and what it looks like and also its benefits, this is the best time to talk about the nuts and bolts of actually doing it. Before jumping in, just a quick note. Like practicing scales on the piano, running on the treadmill, the power of cognitive restructuring comes from doing it regularly with time. So it's not just a one shot. You need to keep doing it again and again and again. Just understanding and occasionally doing it is not sufficient at all. So if you want the cognitive reorganization to have a significant effect on the life, it must be done reliably and it must become a habit. To do cognitive restructuring, follow these necessary steps. Step 1. Hit the pause button. Cognitive restructuring is beneficial in different situations. However, a great time to use it when you see that you are having a strong adverse emotional reaction to anything, mainly if your answer seems out of proportion of what took place. So here are some ways of responding to a negative feeling. For example, if you feel sad, you start having a beer. When you feel anxious, you start hiding it. And when you feel angry, you start lashing out. Now these are the responses. This is how you respond to negative feelings. But now you have to choose a substitute. A substitute is to use a strong, sudden emotion as a reminder or cue to hit the pause button instead. Once you have paused briefly, ask yourself, what is going on here? When we impede our instinct response to a negative feeling and approach it with curiosity, the chances of handling the situation intelligently are increased. So if you're feeling sad and you feel like you want to have a beer, just know that it's time to hit the pause button. So these are the things you need to do whenever you feel that now you are going to react. Step 2. Recognize the trigger. When you have a strong, sudden emotion as a cue to pause, The next thing is to find out what event triggered the response in the first place. Often, a triggering event occurs in our external environment. For example, a cat cuts off while driving, or a friend makes a silly comment, or someone tries to bully you. So these are one of the triggers that that may ignite your negative feeling. Step 3, notice your automatic thoughts. The automatic thoughts are primary interpretations of what take place to us. We do not initiate them as they are always spontaneous. Usually, these thoughts take the form of memories and images or verbal self-talk. For example, if you see an email from your head late at night, your automatic thought can be, oh no, I must have messed up something earlier. If someone cut you off on the road, your automatically thought can be, what a jerk, etc. Step 4. Identify the emotional reaction and see how intense it is. Emotions are produced from mental interpretations of things that take place. The type and intensity of the feelings we experience vary on the kind of thinking we involve in. For instance, using the above example of driving, if your automatic thought is, oh my God, he almost hit me, I would have died, there are chances that you are going to experience anxiety or fear. If your thought is, what a jerk, you are probably feeling angry. But if you think, what the hell is he thinking? Is he mad? You are likely to feel a stable form of anger. For each identified emotion, rate how intense your feeling was on a scale from 1 to 100 or on a scale from 1 to 10. Step 5. Generate alternative thoughts and re-rate the intensity of emotional response. After noting your emotional reaction, it is essential to come up with alternative thoughts for your initial automatic thought. So instead of, oh my God, he almost hit me, I would have died, you can have an alternative feeling such as, wow, that was scary. He was too close to hitting me, but I handled it well. It is highly beneficial to note the errors in your primary thoughts and develop more realistic and alternative thoughts. You can generate 2 or 3 alternative thoughts for every overly negative automatic thoughts if possible. After that, reassess their intensity. This step is very vital because noticing and feeling relief from decreasing negative emotions is an essential reinforcer of the new habit. If you think of a lower negative feeling, you will get multiple benefits in the long term. So you see, it's quite simple. The first step is to hit the pause button where you relax, you start thinking about what just happened. Step 2, you recognize the trigger. You try to understand, well, I'm feeling this, but what just happened? What activated this? What stimulated this? Step 3, notice your automatic thought. Here you are just thinking, what did you think about? What was your thought pattern? Step 4, identify the emotional reaction and see how intense it was. You rate it. After that, you generate an alternative thought which is in a positive way and then reassess the feeling. And if you see that the intensity of this negative feeling reduces, certainly you'll start having some beneficial effects. But understand, this takes time. It has to become a habit. Core beliefs are the assumptions deeply buried that guide our behavior, how we perceive situations and see ourselves. These beliefs influence how we feel, how we are related to others, and guide our success and satisfaction with relationships and life. Core beliefs are the core of our identity. Similar to our name or gender, they can feel as profoundly entangled. If you consider having a different name, it does not feel right. The same thing is with our core beliefs. We have entwined them for so long that accepting new belief does not feel right, and therefore it takes some time to change. Our core beliefs can be demanding to alter and feel like truth. They are accountable for a constant desire for external approval and validation, low mood, self doubt, and persistent insecurity. They can result in unproductive patterns of behavior such as perfectionism and people pleasing. Also, we notice situations and events that approve our core beliefs and overlook those against the core beliefs. Beliefs are our inner walls without doors and limit us from going through the new potential in life. So, in the next lecture, we shall learn how to change a negative core belief. Core beliefs can be demanding to change as they are often automatic and hidden beliefs, which have become a part of ourselves, our identity. Learning to identify, challenge, and reframe your core negative beliefs and thoughts is an essential step in emotional health. Cognitive behavioral therapy provides different strategies to assist in identifying and changing your core belief. So here are some steps to change a negative core belief. Step 1. Choose a new core belief that you can prefer. So for example, if your old belief is I'm useless, you can pick I'm capable. Never choose I'm sometimes capable or I'm mostly capable, so don't keep a doubt. This is a core belief, so you have to be confident about it. Step 2. Rate your old and new beliefs. On a scale of 0 to 10, 0 means I do not believe it at all, and 10, I believe it entirely. Rate your both beliefs. You may say that you rate 9 on your old belief, for example, I'm useless, and 1 on your new belief, which is I'm capable. So it is very important for you to rate both the beliefs, the new one as well as the old one. Step 3. Which type of negative core belief do you have? There are two types of negative core beliefs. One type is a stable kind. For example, you think you are useless and you do not believe anything else, not even when you are in a good mood. And the other type is the type that goes up and down with your stress, anxiety, and mood. When you have a low mood, you think that the negative core belief is stronger than when your mood is excellent. If the negative core belief deviates due to transient things such as your stress, anxiety, or mood, it can assist you in starting to see that the belief is a combination of these things which is not right. So if you are in a good mood, happy mood, and you feel that, well, you're not that bad, but when you are stressed, you feel I'm totally useless, it means it's not actually you who is totally useless or totally good. It's actually about your level of stress and anxiety and mood that keeps changing your perception. Step 4. Strengthen the new positive core belief instead of dismantling the old core belief. This is the most potent goal. Usually, the thoughts are funny things. When you try not to think about anything, you will feel more about it. Hence, trying to get rid of complete negative thoughts does not work. When you experience negative core beliefs, you can learn to see it as just a thought instead of considering it right. So you cannot just totally dismantle. Whether you like or not, you'll have these old core beliefs, these old negative thoughts. But what we have to learn is to simply think that, well, these are just thoughts. These are not the facts. Step 5. Positive data log. For 15 days, write down the evidence that supports your new core belief. For example, if you try to live in the thought, I'm capable, and you show up to a meeting on time, you can write it down like an evidence that you see, I'm capable, and that's why I could make it on time. I could reach to the meeting on time. So start noticing even the smallest of your achievements that prove that you are capable. Never try to fall into the cognitive bias trap of overlooking some of the evidences. For example, if you make a mistake and then find it out, it is an evidence that you are capable enough to identify and find your mistakes. So hence you can put it in your positive data log. So don't overlook. You have to be very, very vigilant. You have to identify every positive thing that happens in your life. And step 6, now re-rate the old and new core beliefs. You remember in the step 3 and step 4, we were identifying the kind of core belief, and we were trying to rate them, especially in step 2 where we already rated our old and new belief. Now since you have already gone through these steps, at the end you have to check whether it helped. So now you have to re-rate the old and new core belief. And you will see a little bit of change while re-rating the beliefs, hopefully. For example, now you may believe I'm useless is only 5 and not 9 like earlier, and the belief that I'm capable is now 5 instead of 1. And you'll see slowly the new positive belief will start becoming stronger and the old negative belief will start fading out. You may have had the negative core belief for an extended time, hence changes usually take a time of few months of intensive work. So don't lose hope and keep it up when you start doing it. Mindfulness includes focusing on every event experienced in the present moment within our mind and body. And of course, with an accepting, non-reactive and non-judgmental attitude. To be mindful, we can start to counter numerous everyday suffering such as depression, anxiety, and stress. We are learning to see events in a more detached and impersonal way. There is a term called MICBT, which is mindfulness CBT. The MICBT is a 4-stage therapeutic process that includes mindfulness and some basic CBT to assist people in improving the way they feel and change their unaccommodating behaviors. This therapy helps individuals make changes differently. It tries to aid people in learning to develop control over several processes that maintain unrealistic beliefs and thoughts through the training of mindfulness. It assists in changing the thinking process, not only the content of your thoughts. The 4 stages of MICBT are personal stage, exposure stage, interpersonal stage, and empathic stage. The personal stage. This stage will help you learn different mindfulness skills to consider and let go of the unwanted emotions and thoughts to address various challenges of life successfully. At this point, you will develop patience and deep insight and understand that there is no need to be prey to each emotion that you feel and every thought that comes into your mind. Exposure stage. During this stage, you will learn to apply different self-regulation skills in circumstances that you may avoid, resulting into your self-confidence. Interpersonal stage. In this stage, things will help you develop better communication skills and interpersonal understanding in the face of anxious situations with individuals and learn not to react to others' reactivity. And the last stage, empathic stage. Here you will learn how to increase your capacity to be compassionate with yourself and kind to others in your regular actions, resulting in a deep sense of self-worth and greater sense of connectedness and care with other people. So these are the 4 stages of MICBT. But here this is out of the scope of this program, so we'll not talk about this much. But mindfulness is a very nice technique, and you can check out other courses on mindfulness. But there are basic things. For example, if you want to practice mindfulness and you want to practice sensory mindfulness, and imagine you are going to eat an apple. Your eyes have the sensation, so you can look at it, try to look at the texture, try to look at the color of the apple. Then when you touch it, you feel it. What is the texture? How does it feel? Is it cold? Is it warm? When you taste it, you bite it, feel the taste, feel everything that is related to that apple. So in an overview, this is what the mindfulness is. But of course, it is a totally different technique that you need to learn in detail in another program. When it comes to talking about procrastination, the CBT therapist focuses on behavioral strategies that improve the link between behavior and the environment. The therapist starts working on ABCs. A means antecedents, B is behavior, and C is consequences. For increasing the frequency of procrastinated activities, the therapist asks the client to change the environmental antecedents to make it easy to start, change the behavior to make the process manageable, and modify the consequences to keep it going until work is complete. Besides, the CBT therapist work on correct the thinking pattern of the client, break the task into smaller steps, reward the client for positive steps, and ask the client to concentrate on the positive. CBT therapists can help clients in reducing depression, anxiety, and stress, primarily through a technique known as behavioral activation that you already read about. The client and the therapist work together through behavior activation to reintroduce some events into the life of the client. It assists in improving the client's mood by increasing feelings of purpose and usefulness, boosting self-confidence, increasing physical activity, and reversing avoidance as well as decreasing negative thoughts. Activating behavior can include different actions. The common ones include reintroducing formerly enjoyable activities, introducing new agreeable activities, and coping behaviors that will decrease particular stressors of life, such as calling a separate family member, cleaning up a messy wardrobe, or filing the taxes, or doing anything similar to that. The essential CBT techniques for stress, anxiety, and depression are the following. Journaling. You can journal, you can write down for self-reflection and to identify the thought patterns. Nightmare exposure and re-scripting. This is used to treat nightmares and develop new responses. Relaxed breathing. It is used to support range of issues, and it calms the body and the mind and helps the client focus. Play the script until the end. Now this is a term, this is a technique. It is used to treat anxiety and fear, reflecting on the worst case scenario, improving the feeling of coping. Progressive muscle relaxation. It helps you calm and focus on physical relaxation. Cognitive restructuring. Finding out cause of faulty thinking, reframing and restructuring them. Introspective exposure. It is used to treat anxiety and pain, and it instills understanding that sensations are not dangerous. Exposure and response prevention. Purposefully exposing self to trigger, controlling the response mindfully. So these are some of the techniques that can be used to deal with stress, anxiety, and depression. CBT is a therapy that shows how specific cycles and patterns of thinking and behavior can have a disastrous effect on our healthy functioning. Through a process of written exercises, psychoeducation, and inquiry, a CBT therapist helps the client understand what type of behavior and thinking pattern he or she may be involved in. The kind of behavior and thinking that are facilitating the phobia. Through a series of further experimentation and exercises, the therapist helps find out effective strategies and a new perspective that allows the client to decrease, manage, and or entirely remove the fears and phobia from life. CBT therapy for phobias is highly effective if the client can engage actively in different activities, including testing a new behavioral strategy, completing a thorough record exercise, and or keeping a journal. A part of the CBT treatment process that the therapist can utilize to treat phobia are desensitization and exposure therapy. It involves imaginary or real exposure to the fear gradually so that the client feels less anxious about it. It helps people to gain control over their fears and phobias. Target panic attacks by exposing the individual to a fearful situation. Different interoceptive exercises utilized by the therapist permit the clients to challenge the physical sensations related to panic without letting them spiral into a panic attack. While talking about imaginal exposure, the CBT therapist reads the script of a fearful situation to a client in session again and again until anxiety of the client diminishes. In vivo exposure is used to assist clients in reducing their tendency to avoid the situations that often prompt a panic attack. A hierarchy of challenging situations is made and the client works through different steps gradually with the help of a therapist. Finally, the client develops the attitude that they will seek out and challenge difficult situations. The therapist works through these stages. 1. Recognizing and replacing negative thoughts. 2. Using a wide range of exercises and activities. 3. Skill building and behavioral changes. And the 4th, relaxation techniques. CBT uses different exercises and questions to help to know about the triggers which can cause the anger to become excessive and therefore leading to angry and unconstructive outbursts. When the CBT therapists come to know the triggers and their causes, they can apply different techniques to see which solution works best for the client. The therapist designs the following sets of techniques to help the client control his or her anger. For example, mindfully acknowledging the anger. Second, rating the anger. Third, weighing the pros and cons. Fourth, taking a break when in a triggering situation. Next, considering alternative perspectives to develop love and compassion, and at the end, re-rating the anger. So see, again, the whole concept remains the same. Being mindful of the feeling is very important. After that, it's important to weigh how intense it is. Then it's important to weigh the pros and cons, take a break, just pause, hit the pause button, and then find any alternative perspective, develop some love and compassion, and then re-rate the anger. And you'll see that the anger level has reduced. In this way, the CBT therapist help the client identify and test out the highly effective strategies and techniques that enable the client to cope better in circumstances he or she previously found anger-provoking, overwhelming, and challenging. CBT treatment concentrates on decreasing concerns with body shape and weight, replacing dieting with flexible and regular patterns of consumptions, enhancing motivation to change, and avoiding relapse. CBT is more productive and acceptable as compared to antidepressant medication to eradicate eating disorders. CBT is a structured treatment and the goals are set. Different sessions include weighing the client, reviewing the case formulation, reviewing homework, problem solving, and teaching skills. CBT for eating disorders consists of the following techniques. Psychoeducation to know what maintains the disorder and the medical and psychological consequences. Replacement of dieting with healthy eating. Meal planning. Completion of food records immediately after eating. Regular weighing to check the progress. Development of strategies to prevent binges such as problem solving techniques, use of delays, etc. Replace all or none thinking. All or none thinking is actually very interesting. It's like I'm going to eat everything or I'll just fast. It's just like judging someone into two categories. Someone is either good or bad, but actually there should be a balance. No one can be either completely good or completely bad. The same way, replacing all or none thinking. And then of course the relapse prevention. A mind changed by addiction cannot make a healthy environment of changeable emotions, negative emotions, and compulsions for drug use. These elements can easily color how individuals relate to their experiences and alter the way they view their substance abuse. Along with any pre-existing mental illness or patterns of negativity, this imbalance can fuel drug abuse and lead an individual to self-medicate. According to the CBT approach, or the cognitive behavioral approach, addictive behaviors such as food addiction, video game addiction, compulsive shopping, problem gambling, drug abuse, drinking, and all these other unhealthy, excessive behaviors are the results of negative feelings and inaccurate thoughts. CBT has different goals to encourage this openness and promote healing. These include identifying the circumstances or issues which are linked to addiction, developing an awareness of negative behaviors, feelings, and thoughts which lead to addiction, identifying the negative ways of false beliefs and thinking that make addictive behavior worse, and evaluating why these thoughts are there and how they can be eliminated or reshaped differently.